Did you know that mixing certain medications or even eating a specific fruit could turn your treatment into a health hazard? It's true. What you don't know about drug interaction could be putting your health at risk. But don't worry. In today's video, I'll guide you through everything you need to know about drug reaction and drug interaction so you can stay safe and get the best result from your treatment. Okay? Hi everyone. Welcome back to MedEd Pharmacists in Focus. I'm your host, Ngoya Nicholas, your trusted pharmacy practitioner. I hope I am. So today we are tackling a topic that impacts nearly everybody, okay? But often goes unnoticed. I'm talking about drug reaction and drug interaction. It doesn't matter whether you are managing a chronic condition, taking over-the-counter remedies, or just trying out herbal supplements, okay? Understanding how these substances interact can be a game changer for your health. So by the end of this video, you will have the tools to prevent harmful interactions and get to make informed decisions about your medications. So I want you to picture this. Your doctor prescribes for you multiple medications, one for high blood pressure and another one for a blood thinner to reduce the risks of blood clots. You take them as instructed, but within days, you notice unexplained bruising and feel unusually lightheaded. Okay? So what may be happening? This is likely a drug-drug interaction in action. This is where two medications clash, leading to unintended and sometimes very dangerous consequences. Okay? Let us explore how and why this happens. What do we mean by drug-drug interaction? Drug-drug interaction occur when one medication affects how another one works in your body. Think of medications as co-workers on a team. Ideally, they are all working toward the same goal, ensuring your health improves or your condition is managed effectively. But just like in a workplace, sometimes miscommunication or a conflict arises. It is normal. So this may disrupt the balance and may cause problems. Okay? So let us break this down further with the examples and a detailed explanation for easier understanding. Let's begin by blood pressure medication and blood thinner medication as our first example. So imagine your doctor prescribes lisinopril, a medication used to manage high blood pressure, and warfarin, a medication used to manage blood thinner. Is a blood thinner, okay, designed to prevent blood clots. When these medications are taken individually, they work very well. However, when taken together, lisinopril can enhance the effect of warfarin, making your blood to thin even further. This could increase your risk of excessive bleeding, leading to complications such as bruising, internal bleeding, or even anemia. The second example is pain relievers and antidepressants. Suppose you are taking a selective serotonin reuptake inhibitor like fluoxetine for depression, and at the same time you're also using non-steroidal anti-inflammatory drug like ibuprofen for pain reliever, a very common medication. So these two drugs can interact by increasing the risk of gastrointestinal bleeding. The combination of their effects on platelets and stomach lining can result in ulcers or other complications. Okay? So, how do these interactions happen? Drug-drug interactions can occur in three main ways, each involving different mechanisms in your body. Let's have a look. The first one is through drug absorptions. So drug absorption is the process by which medications enter your bloodstream after being consumed. When one drug interferes with another one's absorption, it can delay or reduce its effectiveness, which may lead to suboptimal treatment outcomes, okay? For instance, antacids, commonly used to alleviate heartburn. They contain compounds like aluminum or magnesium that can bind with antibiotics such as tetracycline or ciprofloxacin. So this binding prevents the antibiotics from being properly absorbed into your bloodstream, much like trying to dissolve sugar in cold water, okay, rather than hot water. The conditions aren't ideal and the antibiotics efficiency is compromised. These interactions underscores the importance of timing your medications appropriately, okay, to ensure their effectiveness is not diminished. So another pathway that medication can interact is through metabolism, okay. So metabolism is another critical area where drug interactions occur, primarily in the liver. The liver acts as the body's detoxification center, so processing and breaking down medications into forms that can be easily excreted. That is the function of the liver. But some drugs, however, can alter the speed at which the liver metabolizes other medications. That's when taken together. For example, antifungal drugs like ketoconazole can inhibit the enzymes responsible for breaking down cholesterol-lowering medications such as simvastatin. Okay, so this inhibition can lead to toxic levels of simvastatin accumulating in your system, resulting in severe side effects like muscle pain or even liver damage. Picture this. Picture the liver as a factory assembly. Picture the liver as a factory assembly line. If one machine slows down or malfunctions, then the entire production process is disrupted, causing a dangerous buildup of substances. Okay. Another part, the way the medicines can interact is through excretion. So excretion is the final phase. It involves the kidneys filtering out drugs from your body through urine. When medications impact how the kidneys function, they can alter the duration durations a drug stays in your system. Okay. For instance, diuretics, which are often prescribed to manage high blood pressure by increasing urine production. So this medication can interfere with excretions of lithium, which is also a medication used to manage bipolar disorder. This interference can cause lithium levels to rise dangerously, okay, leading to toxicity. So such interactions highlight why regular monitoring and dosage adjustments are critical for patients on medications that rely heavily on kidney excretions. So be a friend to your doctor, okay? I have this key tip that you must do. Always provide your healthcare provider with a comprehensive list of medications, including over-the-counter drugs, vitamins, and herbal supplements that you are using. So this transparency helps them to identify potential interactions and adjust your treatment plan accordingly. Okay. So for example, if you are taking a herbal remedy like St. John's wort for mood improvement, St. John's wort helps to is used to manage moods. Okay. Suppose you are taking that medication, a pharmacist will know it can reduce the effectiveness of birth control pills or certain antidepressants by speeding up their metabolism. Okay. So be your doctor's friend. Thank you for watching and taking the time to learn about drug interactions. Your health is important, and understanding these interactions is a big step towards staying safe and getting informed. Now that you've seen how drugs can interact with each other, imagine how the food you eat could affect your medications. Could your favorite meal be changing how well your medicines work, or even putting you at risk? In our next video, we'll uncover the hidden world of drug-food interactions and what you need to know to stay safe, okay? Don't miss it. Thank you and bye-bye.